So back in March, this is where we started to take our patients with coronavirus into intensive care.
Dr. Aoife Abbey admitted this hospital's first COVID-19 patient. Now her critical care unit dedicated to COVID treatment is empty.
May, June. This was a hive of activity and just patient after patient.
But she's watching the UK's rising infections with some trepidation.
What we are holding our breath to see if this spread in young people, to see if that actually starts to translate into cases of those who are more vulnerable. And certainly in this trust, we are getting ready. And all of the planning that we did during the pandemic when it was at its worst, we are still doing now.
Not only are infections rising, people are still dying. This hospital lost a patient to COVID just last month. Everyone hopes these critical care beds will stay empty. The doctors here will be looking at what's happening in Europe. During the peak of the pandemic, we were just a few weeks behind what was happening over there, being repeated over here. Now in France and Spain, infections are rising, and so too are hospital admissions. After one of Europe's strictest lockdowns, Spaniards were desperate to return to normality. But many blame the easing of restrictions on this latest rise in infections. The new cases are mostly younger people who aren't becoming as sick as patients earlier in the outbreak. But hospital admissions are climbing.
At the very beginning of the second wave, we started detecting younger people than in the first wave. After many cases that were significantly younger, we are now detecting again older patients. The situation now is more controlled. That doesn't mean that in the future, if the number of cases increase, we are going to be in problems again.
The NHS has learned a lot about COVID-19. Treatments are available and valuable experience has been gained. But going back to where we were is just not worth thinking about.
The idea of having to go through it all again is difficult to comprehend. From my point of view, the psychological toll on people was massive. Going to work every day in those circumstances was hard.
The warning is UK hospital admissions will increase, but we don't know by how much. All we can do is be prepared. University Hospital Coventry says it is. Ashish Joshi, Sky News.